Okay, I am going to be doing my sim patient. I actually have calculus all over my typodont, as you can see. So this is like a D patient. I know I only have to be an A, but we're just gonna go with it. I'm using the Nebraska 1-2 on the lower anterior to start with. And I am just kind of holding these teeth in place with this hand just so they don't come out of the mouth because they're kind of loosely in here.
It's like the instructions, it's not like in a PDF, it's just like what it's listed on the website. So do you want, I can screenshot it and email it to you. Okay. Oh, you saying you're looking at it right now? Oh, okay, sorry.
I'm gonna use the H67 to start off with anyway, because it's wider and it's hard. Like, it's
Is it okay if I take a quiz in the computer lab? Are you taking the one I think maybe?
Okay, so that was all my surfaces towards. Now I'm gonna do the surfaces away. Try to simulate 12 o'clock as best as I can in the computer lab.
What year did you enter dinner system?
I entered 2017, graduated 2018.
The issue with me using this is now you can't really see the teeth, so maybe I can try to see.
I like the way it contorts the living. Like it, I don't know, just has the way it angles.
especially since it's on the surface, I can't go wrong with it.
Concave area.
Yeah.
Right, why is it this? Right. But then you just check and then.
The only thing I hate is on the call, and I should love it.
So I couldn't figure out how to like get it to stand up from this view because I wanted to clip it right here,
Okay.
but I couldn't. So
Does anybody else want to try to use this for your simulation?
try to figure it out.
Thank you, Cynthia. My tripod
Yeah.
doesn't like to stand up.
And then you can plug this in and you can see the
Oh, that's pretty cool. Where'd you say, Spencer?
It's kind of hard to do these lower interiors just because I'm not in a good position.
Yes. Yeah. Right? For the above 3 points? Yeah.
Trying to make sure I'm staying on the lateral border or the lateral surface of my instrument.
For real?
I usually do the opposite of what I think because that's normally right.
Okay. So now that I've got the majority of the heavy stuff off of the lower anteriors, I'm going to move on to the posterior, and I'm going to use my 4R4L because there is some subgingival calculus.
Hi, this is going to be my STEM patient, quota patient number 3.
Okay, So I have the right end of the instrument. Now, didn't put any calculus back here, but
And that is going to be my first patient, and then afterwards, I am going to do the pink.
do we get credit for these patients no matter what?
I really have no idea how that's gonna go.
Especially on my legal side, and the reason for it is being on here for at least over 3 days was really hard, and especially with my 867 is very hard, so I was able to get better credit. So if I was sitting in on a patient, I would be actually
Miss Burton, what's your email? Because that's not popping up on my.
Okay. Okay, now I'm gonna do the lingual. I have a piece of really old calculus on the root surface of this tooth that I'm on right now. Didn't put any on this tooth. Okay. Alright. I got all the subgingival calculus, which I will go back and check with my Explorer to make sure that I got it all subgingivally.
I wonder why they didn't have the questions in the book.
What happened?
And I am going to go back over with a scaler just to make sure that I get all of that supragingival calculus off. Okay, so now I'm moving on to the lower right lingual surfaces with my 4R4L because, again, I'm gonna try to get some of that subgingival calculus off that I placed. And I know that this isn't the best view, but I don't really know how to put my camera so that you can see exactly what I'm doing, so hopefully you can just see that my shank is staying parallel. I'm gonna do, hold on. Oh crap. Crapola. Okay, so now I'm gonna do the facial surface of the lower right. So I'm gonna flip my instrument. Making sure to stay parallel. Okay. Last one, I'm on the premolar, removing subgingival. Only got a few minutes left on my video, so I might have to end this and just post my before and after pictures. But that's okay. Alright, so I'm gonna go back through with my Nevi. And I'm just gonna try to go ahead and on every tooth that I just scaled, I'm just gonna try to go back and just remove some of that light supragingival calculus. Just to make sure it's perfect. Making sure to stand up on my fulcrum. I'm coming all the way up off the tooth and careful not to flick. Okay. It's hard when we're not in like clinic with a actual Fletcher to make sure that we're positioned correctly. Okay, moving on. Okay. Alright, so I'm actually coming to the 15-minute mark, so I'm going to stop this video here for patient 1, and I'm just going to post my before and after pictures.